Welcome to Men in Pause, the podcast that's changing the conversation about menopause by bringing men into it. I'm Mimi Fernandez, producer of the show, and we've created Men in Pause because menopause affects relationships, not just individuals. And our tagline is where men listen and women lead. When the women in our lives go through menopause, men can go through it too. So we just don't always know what's happening or how to help. So we're launching this first episode by sitting down with David Franklin, founder of Naviday Health. And David will be hosting our future guests. So today I'm turning the tables to ask him the questions that inspired this podcast in the first place. So welcome, David.
Thank you so much for having me here, Mimi.
Let's start with the big one. Why focus on educating men about menopause? And what gaps are you trying to fill?
Yes, so thank you for that question. It's very important because I'm out there talking about menopause. Mainly, I probably had conversations with over 200 women and a handful of men. But what I realized is that women are at the epicenter of the homes, in the relationships, in the communities, in the workforce, in society. And we have to be in, as we're in those same circles, in those same environments, it's better for us to learn how to embrace and understand and learn to be more supportive and caring and empathetic, show empathy in what's going on. So it really starts with education and being able to allow the man in the workplace, in the home, anywhere to be able to have an open conversation and feel at ease with it. We have to change the narrative around menopause, not just from a clinical perspective, but from a societal perspective. Much maternity health, menstruation. If you're a father and you have a daughter and she's going through menstruation and you have to do something, you just go do it and you learn and you adapt. And we have to grow as men to be able to adapt and learn how to embrace menopause. It's her journey, but it's our story as a society, and we need to embrace the collective whole in this scenario. And it starts with education, but it's not just educating the men, which are further behind, but women are so isolated in this journey. They shouldn't be isolated when they're in a relationship or in a workforce environment either. That's where they should find the most support.
So you've done research with Mayo Clinic on menopause. What's the finding that surprised you the most?
We were in the Mayo Clinic Platform Accelerate program. It was lasted about 8 months where we did an observational study of just over 2.8 million anonymized de-identified records. Our initial aim was looking at the impact, longitudinal impact of menopause, postmenopause relative to osteopenia, osteoporosis, and fractures. And then we were able to spend time looking at impacts around or associations to cardiovascular disease. So it was very fascinating to see from a clinical standpoint, not only what was there, but what wasn't there. And we can talk about the lack of ICD-10 codings or how coding's done within medical system. But it's not like we're improving something that existed. We're actually creating something that never existed. There's a big difference in this. And it was really remarkable to understand that in the care system today, there's no pathway to care relative to menopause. Menopause traditionally is seen as a loss of fertility, but if a woman goes into their clinician, they're often told to wait it out. You will get through this. You're just in menopause. It's a phase. It's not a phase, it's a transition because once you're postmenopause, you're always postmenopausal and symptoms could last for 10 years. So really learning that there's nothing designed in our healthcare system to be supportive. So if you went in and you said, I'm having hot flashes or night sweats or migraines, if you just pick any of the top 20, for example, vaginal dryness, their first thought will take them away from menopause towards something else. And we need to curb that back, right? Instead of looking out, we need to come in. The individual as well as the clinician. So just so happens if you happen to be in a range, say 45, 52 in there, the average age is 52 for menopause, at least from our study. But if you're in this range, it may click the notion outside of generally what they do is just ask, when's your last menstruation? And that's what they're gauging it off of. But that's not, episodic care doesn't provide the longitudinal data, it doesn't provide the symptom tracking either. So again, the clinician's going to look elsewhere and going to, chances are 2 out of 3 physician visits prescribe medication, you're going to have a medication which is going to bring on a possibility of other side effects as well that further takes you away from. And therefore, this is why, in many cases, that can lead to why we have a 7-year delay in diagnosis. Probably one of the biggest things is it just doesn't exist. And how shocking is that? It's not like women were just created and born in society yesterday. And the lack of appreciation and health insights beyond seeing them as and this is what's been spoken before, is a smaller version of a man, like from clinical researcher's standpoint, or women not being technically or mandated to be a part of clinical research till, was it 93? There's just not enough data there, or as they refer to, bikini care as well. So we really just have to create the pathway. We can't rely on the system to do it. They've had hundreds of years to do this and they've neglected it. So now it's taking place on the outside and there's new communities being formed, new specialty clinics being formed outside of the primary care. So that's wonderful.
Yeah. So a lot of men have no idea what menopause actually is beyond hot flashes. What do you wish every man understood about what their partner is going through?
I think one of the most important things to understand is that this is a normal transition and it's unique to each person. It's not a one size fits all. Not every woman's going to have the same symptoms. And our first response, anybody's first response, shouldn't be to put a label on an action, but to look deeper in and try to evaluate how to be supportive when that action takes place. So I think the first thing we have to do is to be still, to learn how to respond versus react, right? And learn how to ask the right question in a supportive way, because sometimes we only just need to listen.
Mm-hmm.
That's all we need to do. That could be the best caregiving position. Or sometimes we need to do something, but we need to understand from them what do they need from us. So just being open up to listen and to remove labels. Because if you think probably historically through families, conversations, these were more intimate conversations, very private, and that the parents didn't speak out loud, and the parents probably didn't speak with each other about either. So there's no history and no education and no grooming generationally. But this is where we need to open up. And I think in society today, as we progress, and there's a lot of challenges out there, I do see one area that we are evolving our brains and trying, there's ways that we're trying to be more conscious and more awake at large. Just being there and just being available. And then do the research. If you know that they're going through this, whether it's labeled menopause, perimenopause, early pre-menopause, any of this, even post-menopause, when you learn that this is what's happening at this time regarding the symptom, then do some research and try to understand it and try to understand its impact and how you can be supportive. I think historically that a lot of times labels are thrown out there or things are said out of haste very quickly because people are reacting to a bad situation, what seems like a bad situation, when the other person is going through something. And here's the thing too, is that when things are happening to us on the inside, everything on the outside looks normal. So when people respond, they're responding to what they think is just something They see a normal person, but they don't understand what's really going on and what that person's going through. So that's why we have to be patient, be still, and allow time to respond and ask what's needed at this time.
I think that's such an important point because it's so hard for women to articulate what's happening and they need the time and space to get there. So having that with their partners is really helpful. Through your work with Navigate Health, what are you hearing from women about what they need from the men in their lives during this transition?
Yeah, it's interesting in phrasing the question, what they need from men. Today, I spoke to two women, and it's also what they need from their clinicians, right?
Hmm.
Which may be males as well, maybe not. But what they need is not to be labeled, not to be set aside as, oh, you're acting crazy right now, or it's just menopause, or you get through it and you can get past it. Those aren't embracing words, so to speak. They need a pathway, they need guidance, they need structure because every conversation leads them somewhere else. There's no definitive pathway established, right? And here you have to look at it from an individual standpoint, but there's no sort of gold standard pathway. If you're if you have a different chronic disease or if you're going through, there's protocols, there's standards, there's guidelines, and it's very unstructured with menopause because there's no prescription for menopause. And maybe that's where the challenge is because there's a lot of prescriptions for everything, but there's not a prescription for menopause because you're dealing with an enormous amount of symptoms that may or may not be related to this. I recall in one conversation, if you could imagine a typical family, maybe you have a child in college, or in this is a real scenario in this one couple. They had one child graduating college, one becoming a senior, one of the parents selling their business, and the other one working. And the other one working is the wife, the mother, the woman in the relationship, and she's in late 40s. So imagine how, in a real life situation, if you're under a lot of stress, anxiety, maybe some depression, there's a lot of hormonal changes that are taking place at the same time. But outwardly, there's so much stress and chaos going around us. So it's so easy that if you're feeling stressed, burnt out, and having symptoms coming in that you look at, oh, it's just this business acquisition. Oh, I'm stressed over my daughter's college, or maybe it's a marriage, or maybe it's a divorce, or maybe it's how to plan for vacation, or all these other things. And what I'm saying is that we have to look in first, right? Don't look out. Let's check in with ourselves, right? And this is so very important in my conversations with women. Look in, understand you're a remarkable person. This isn't a time to empower yourself, to strengthen yourself, and to make healthy decisions for yourself, and to set healthy boundaries for yourself and carve out space for yourself. Because one of the things I learned for me personally is I became something to everybody, nothing to myself. And in this time, these remarkable women need to find themselves, right? And they need to find that story that's going to carry them throughout.
And they need the space and time to do that. And
Yeah.
let's talk about the awkwardness factor. Many men feel uncomfortable bringing up menopause. What's your advice for starting that conversation without making things weird? And should they bring it up at all?
I think you should bring it up, but it's how you bring it up and when you bring it up. You don't want to bring it up in the midst of something because that would seem counterintuitive and may appear like a attack in some ways. In a normal comms, you go in with curiosity, right? To explore, to understand, and you go in not knowing, asking, what are your thoughts about this? Are you experiencing anything? Do you know if your family, your aunts, your mother, your grandmother had anything? Sometimes the symptoms are similar, maybe not, but sometimes they are. So they may have some insight and just lead with being curious and being supportive of, we know this is going to happen. It's like life planning. You plan for so many things in life. Let's change the narrative to where we can have these conversations especially in the mid 30s. Let's not wait, right? Let's start educating now so we're aware when things start to happen to help our clinicians be aware of these things. So it's just starting, and I encourage men, even when I'm talking to VCs from a business standpoint, I was like, go ask your wife. Would your wife support what I'm doing? I know you may not fully understand what I'm doing, but go home and have a conversation with your partner, with your wife, talk to your daughter, talk to your aunt, your mom about menopause and see what reaction you get from them and try to understand from their point of view what we're doing.
Yeah. I love that. And so, looking ahead for what this series will be, what kind of conversations are you hoping to have with guests? And what do you want our listeners to walk away with from each episode? Because I know this is the first, but we're gonna have hopefully 12 to 13 of these with different experts.
Yeah, I'm very excited for the agenda that we have put together. The speakers, clinicians, OBGYNs, menopause specialists, nutritionist, psychologist, everyday people that have gone through menopause or are going through menopause, real life discussions. I think it's very important we understand clinically what's happening, biologically what's happening. We understand that there's differences between men and women, like our clocks. I have one clock, you have two clocks, how you're managing those two clocks and what, you know. So just bringing in these real life conversations. Yes, we need to help make men allies and advocates and be supportive, but we also need to help raise the narrative and change the narrative to even for women to be more empowering in these conversations with their clinicians or with any of their providers or even in their workforce, how to do this. So what we hope to get out is really learning conversations and breaking down the clinical and real consumer friendly type of conversations, really learn about the differences of what's taking place and how in the uniqueness we're all together and we can all be supportive in a better way and just learning how to change this narrative and make the conversation more easy for everybody. And we do that first by educating ourselves to have these more informed decisions.
And I think having a male voice like yours is really unique for us here too. I'm really excited about the future conversations and thank you for today. And here we go.
Here we go. Thank you. Let's do it.